kidneys are as equally important as heart, as brain, because we are not taking care of it as much as it has to be taken care of. There are different marmas in our body. So out of important marmas, these are the three main vital marmas which are pranghatak. If there is any hit or any kind of damage to those marmas, it's kind of fatal.
Kidney is actually one of the marmas in the body, and that's why it's so important to take care of it.
Kidney is a part of the genitourinary system. So that genitourinary system where it has that amalgamation is basti.
How will I know that there is something wrong happening with my kidneys?
When there is a vata accumulation, for example, or vata is predominant out of all the three doshas, either it can lead to just vata based disease like frothy urination, or if it is mixed up with pitta, or if it is mixed up with kapha, then it would be a combination of a symptom. There is a concept of Ashtamahagada, which is called the 8 major diseases which are mostly incurable or difficult to treat.
Do's and don'ts at home that one should follow if they want to take care of their kidney.
So first and foremost, hydration. The exercise part is also very important.
Are there any kitchen box herbs that I can add to my diet every day which can ensure that, to some level my kidneys will be taken care of?
Depending on, again, doshas.
Kidney health is often overlooked, and we don't notice too much about kidneys till the time real problems arise. Kidneys do so much for us: filter toxins, balance fluids, and maintain such vital functions for our body. Yet, chronic kidney disease is on the rise, and there are not a lot of solutions for it. But don't worry, today in Ayurveda and You, our podcast, we have an internationally acclaimed Maharishi Vaidya, Dr. Amandeep Kaur, who has served as a clinical director with Maharishi Ayurveda International Clinics in Iowa, USA. She is going to tell us why kidneys are important from the perspective of Ayurveda and how you can take care of your kidneys using simple Ayurvedic lifestyle and practices. Welcome, Dr. Amandeep.
Thank you so much, Dr. Rini.
So, Dr. Amandeep, kidney and its role. What does Ayurveda say about it?
So in Ayurveda, kidneys have been very, very vital organs, just like 3 important marmas. So one is basti, one is hridaya, and one is nabhi. So that basti is generally denoted as the part where the kidneys are. So kidneys are basically very beautiful, small fist-shaped organs, and they are just the natural filters of our body.
Yeah.
And in this scenario, when Ayurveda is also, it has it has given a lot of importance to the kidneys as vital organs. So it is very, very important to protect them, and it is very important to understand the functionality also behind it.
Yeah. So this term basti, you said that kidneys are a part of that.
Mhm.
What is the exact role of this basti in your body?
So basti, as I told, it's one of the most important vital organs like marma. So it is, as acharyas have mentioned, like 6,000 years ago, we have had this Ayurveda wisdom. So in Ayurveda, it has been mentioned that there are different marmas in our body.
Okay.
So out of important marmas, these are the 3 main vital marmas which are pranghatak. So which are basically, if there is any hurt, any kind of hit or any kind of damage to those marmas, it's kind of fatal. So this is why kidneys have come under that category.
So if you can just make my viewers understand what is marma and what is its importance in the body.
So marmas are vital hearts, starting from Adipati, Shringatak. Different kind of marmas are there. 107 marmas are there. So all these marmas are very important, like pressure points. But they also hold a kind of a cluster or kind of amalgamation of certain kind of blood circulation, where the blood circulation is at its maximum. So this is where those points are very vital for our physiology.
So you're saying kidney is actually one of the marmas in the body, and that's why it's so important to take care of it.
So kidney is a part of the genitourinary system. So that genitourinary system where it has that amalgamation is basti.
Okay.
So that kidneys are originated as different organs. It's a pair of kidneys. And those kidneys, when they are connected through ureters, and they actually connect through, to the urethra. So then urethra is a place where the whole filtered, toxins as urine is collected.
Yes.
So that urethra or the urinary bladder. So that is the place where it is the whole, the toxins are completely collected in the physiology, and that is where it is getting, eliminated from.
So I understand that, kidneys have a role in filtration and Ayurveda recognized that long ago. And how does this filtration really happen? Like, is there some system that Ayurveda recognizes which is contributing to that, filtration? Because I know Ayurveda recognizes purification therapies and does all of these things. So kidneys, how do they really function? What is really giving them the power?
So we have a different kind of srotas in our physiology. So srotas, according to Ayurveda, there are 13 different kind of srotas. These are basically the channels, the circulatory channels, which actually have a very, very vital role to circulate or transport the different hormones or different kind of fluids from one organ to another. And also it is responsible for the, in fact, blood also, So blood, lymph, plasma, and different kind of hormones as well, insulin. So there are different srotas. So kidneys have been recognized as the organ of origin where the Mutrava srotas are connected, and it actually forms a genitourinary system. When I was talking about the kidneys and the ureters and the urethra and then, urinary bladder. So everything comes together as a genitourinary system.
So tell me this, Dr. Amandeep, because growing up, we're not really told to take care of our kidneys. We're told to take care of our stomach because, constipation issues, bachon mein bahut hote hain. Or we're told to take care of our liver maximum, when your appetite is really low. But nobody really focuses on kidney health. So where do we go wrong? And what symptoms can actually show that we're going in the wrong direction?
This is a very beautiful question. And I think this is very important and imperative for everyone to know that kidneys are as equally important as heart, as brain.
Oh, wow.
And we do not know too much about kidneys because we are not taking care of it as much as it has to be taken care of, right? So generally what happens is, as I told you, kidneys are the natural filters. So when kidneys are filtering the fluids and blood, because there is this, it actually functions in the form of nephrons. So the nephrons are the specific, parts of the system, this genitourinary system, where the kidneys are filtering in terms of filtering to the blood as well. And then whatever toxins are released, they are filtered in the form of urine.
Yeah.
Right? That fluid is collected in the urinary bladder and then it is eliminated. But what happens is when this filtration process goes weakened, there are different kind of nidana. Nidana is causative factors. So different kind of nidana, when the person is having nidana, when the person is, having different lifestyle issues like sedentary lifestyle or not drinking enough water or say alcohol or smoking or even comorbidities like hypertension, diabetes. So all these problems would lead to, dosha vitiation, and that is where the filtration gets weakened.
Yeah.
So over a period of time, what happens is kidneys start getting overburdened because the filtration is not happening properly.
There's
right?
too much for it to filter.
Yes.
Okay.
And because there is accumulation of toxins. And if there is a sedentary lifestyle, for example, the Agni can also get vitiated. Digestive fire gets, suppressed. And that suppression of digestive fire would lead to toxin accumulation. In Ayurveda, we call it ama, right? So in this case, what happens is different kind of sampraptis or pathogenesis would occur depending on what dosha is involved, right?
Okay.
So in that case, there is the formation of different kind of diseases in kidney, and the prodromal symptoms would also be there.
Okay.
Like somebody would say, I have a sharp shooting pain in the flanks, or I have a pain in the back of my body. Or somebody would say, I am, having some giddiness or some kind of weakness or some dryness on my skin. So depending on the dosha imbalance, there are 3 doshas, right? Vata, Pitta, and Kapha. So according to the dosha, there would be a different prodromal symptom based on, again, which dosha is localizing or manifesting in the weakened area of the physiology. So we call it missing piece of intelligence, right? So where there is a lack of consciousness or where there is a missing peace or lack of intelligence, that is where the doshas get manifested.
Okay.
Right? So according to that, if there is a vata dosha which is getting manifested or vata dosha which is vitiated, aggravated, and it's like there is a 6-stage, samprapti or pathogenesis. There are 6 steps of samprapti. So according to that, if there is vitiation of dosha in terms of vata, if I say, accumulation, aggravation, and then, prasara, we call it manifestation or dissemination.
Yeah.
And then it gets localization.
Yeah.
So this is where the localization of vata happens in the kidneys or the, urinary bladder. But then we also need channels. We also need srotas.
Yeah.
The circulatory channels in terms of mutravaha srotas. So in this pathogenesis, mutravaha srotas would be responsible because they are channelizing or they are circulating the toxins from one place to another.
So you're saying that there are 2 things. One is, of course, what kind of dosha imbalance will happen at the site of kidneys. That determines what the outcome will be. So, for example, if vata is dry and light and airy,
Yes.
it will lead to some other outcome versus a kapha type of imbalance or a pitta type of imbalance.
Exactly.
And the second thing is your micro channels that actually can have an accumulated toxins or, excess of toxins, which can also lead to kidney problems. So these 2 things need to be taken care of.
Yes.
Okay. How does it manifest? How will I know that there is something wrong happening with my kidneys?
When there is a vata accumulation, for example, or vata is predominant out of all the 3 doshas. So it can lead to just vata based disease like frothy urination. For example, it's a symptom, frothy urination. Or if it is mixed up with pitta or if it is mixed up with kapha, then it would be a combination of a symptom. So it can be frothy urination with burning if there is pitta involved. If there is a, itching or some slight, whitish urination or milky urine, and then it might be kapha involved in vata. So depending on that, it always makes the symptoms different, right?
So I need to look out for my urine color, frothiness, and whether it's milky or not.
Yes.
Okay. So once I've looked at that, how do I, start making changes? How do I know that, oh my God, I have a burning sensation, I have milky urine as well, and I have frothy urine. So these are 3 different symptoms that you've told me about. If you can go deeper into, other manifestations as well as the solutions, I think that'll really help.
So it is a wonderful topic in itself because it's not only these 3 kinds, I would say. It's just the starting which I just picked up. But actually what happens is when there is manifestation of vata, for example, it is also before that, I would actually start with the natural formation of urine, right?
Okay.
So the pH level of urine varies from 4.6 to 8.
Yeah.
Okay. So when it is less than 4.6, it would be acidic. When it is more than 8, it would be alkaline. So depending on a disease, the pH level or pH balance of the urine also gets changed.
Yeah.
And it also varies because of the filtration capacity of the kidneys.
Yeah.
So if the kidneys are filtering the urine properly or the kidneys are filtering the toxins properly and the urine is getting eliminated in the exact pH range, then it is fine, right? So otherwise, what happens is if the urine is like without any smell, for example, or if the urine is clear, that means the filtration is getting well. But if the urine is towards yellowness, for example, that also means dark yellow, for example, that means it is not getting filtered properly. It might be getting acidic. So as I was telling about the yellowness of the urine, depends on the pH balance, pH imbalance of the urine, right? So if the pH level goes below 4.8, the urine turns to be acidic, right? In modern terminology, I would say, yes, the urine has become acidic because it can also happen due to diabetic ketoacidosis, which is, a complication of diabetes, or it can also happen because of excess of protein intake, or it can also happen because of other infections, right? But what happens is if there is an alkaline urine, so that alkaline urine, which is the pH level, which is beyond 8, right? So then it can be probably because of, gastrointestinal problems like vomiting, for example. So due to vomiting, there is a disruption in the pH balance of the body,
Okay.
right? And the urine also becomes alkaline.
Okay.
And also in other diseases also, sometimes when there is a chronic kidney failure, the urine becomes alkaline. So this is the modern part. But then from Ayurveda perspective, there are different kind of, as I was talking about doshas, but Mutravaha Srotas, which is the responsible factor of circulating the toxins or circulating the different fluids in the genitourinary system.
Yeah.
So what happens is, if there is a disturbance in any dosha, there are in Ayurveda different kind of Mutravaha Srotas Vyadhis, or we call it diseases because of urinary system. So or urinary channels. So what happens is, in Ayurveda we have seen, like, there is a concept of Ashtamahagada, which is called the 8 major diseases which are mostly incurable or different or difficult to treat.
Yeah.
Right? So Prameha is one Vyadhi or one disease which is Ashtamahagada, a part of Ashtamahagada. And then Prameha is a Mutravaha Srotas Vyadhi.
Yeah.
Or we call it disease of urinary system.
Okay.
Okay. So in Prameha, there are again different types, Vata, Pitta, and Kapha. So why I'm emphasizing Prameha here is because the whole pathogenesis of urinary system or the kidney related disorders is leading to one or the other complications. And in Prameha, there are 10 kinds of Kaphaj Prameha, 6 kinds of Pittaj Prameha, and then 4 kinds of Vataj Prameha, depending on the prognosis of the disease. Okay, so the Vataj Prameha are the ones which are just 4 kinds, but they are incurable. And one of them is diabetes.
So diabetes is a Vataj Prameha.
It is a complication where the Vata is also involved because it starts from Ojas, Kshaya, or we can say it starts from, for example, when there is a whole pathogenesis, we have to, rule out. It starts from vitiation of dosha, say Kapha, sedentary lifestyle, for example, or day sleeping, or say not having fresh foods, or eating processed foods, or eating too many spicy foods, or eating without having the previous food digested. So according to that, there would be a different scenario of kapha vitiation that may lead to infection or inflammation as well. Then pitta is involved. Then it leads to pittaj prameha. And it may also lead to vataj prameha if vata is involved. So when there are all 3 doshas involved, then there is a high possibility of ojakshaya. And ojas is nothing but our vyadikshmatva, or we call it immunity, right? So that lack of immunity or depletion of immunity from the physiology would lead to complications like diabetes mellitus. And in this case also, there is one main symptom of diabetes, which is profuse urine or turbidity of urine.
Excessive urine.
Excessive urine, and turbidity means milky urine, or you can say translucent or not transparent urine, not clear urine at all. So these are also the issues which we have to really take care of, because kidneys are the very important organs that we need to protect here. If the kidneys are not protected, if they are not filtering the urine properly, if we are not taking care of our diet, our lifestyle, and we are not having the, say, regular detoxification of our physiology on a regular basis, this is what it leads to: accumulation of toxins, and the kidneys get overburdened. And when the kidneys get overburdened, they would lead to different diseases, and the symptoms would change, like vataj, pittaj, kaphaj. There would be milky urine, there would be yellowness in the urine, there would be frothy urination, there would be redness in the urine, there would also be no urine, for example, or painful urination. So these are different symptoms that the person should look out for.
Is urine the only way that I can assess that there is a problem with my kidney?
No.
Is there any other symptoms that I can look out for?
So fatigue.
Okay.
Fatigue is one. And then dryness of the skin.
Okay.
And
if there is a sudden change in those, because some people just naturally have dry skin.
Yes.
And if you see that there is a sudden switch in your skin condition, that's when you know something's happening with your kidneys.
And then we have to also correlate with the, if there is, for example, hypertension, or if there is swelling in the legs. So these are edema, we call it. So that swelling in the legs is also where the Kledak kapha, the water bearing channels are overloaded. And then extracellular fluid is somewhere it is out of, it's in havoc. So this is where we have to understand that yes, there is some swelling in the legs. So you might have seen, in my practice, I have certainly seen that, but you might have seen some people would say, oh, I have been traveling for many hours, for example, for 2 hours or 3 hours, and they have their legs down, sitting, and then they say, I have some edema in my legs. And we have to just figure out whether it is a pitting edema or whether it is a non-pitting edema.
Okay.
So when there is a pitting edema, when we press it and we see there is a pit, and that means there is something that kidneys are actually struggling with.
So they haven't filtered that water out and there's water retention in the body.
Yes.
Okay. So these are some symptoms that, one should look out for. In Ayurveda, what are the big do's and don'ts at home that one should follow if they want to take care of their kidneys?
Okay. So first and foremost, hydration.
Okay.
Hydration is very important. We just have to understand that yes, whether the urine is flowing well, whether it is a good flow in terms of, on a regular basis, like 2 to 3 liters of water is generally, advised by doctors also. But it is not necessary to have 2 to 3 liters for every person. When the kidneys are already overloaded, we might not need 2 to 3 liters of water. So it might lead to some other complications as well. So depending on how much your consciousness is asking, how much your body is needing, you just should drink that rather than overloading yourself with water.
So I see a lot of people carrying jugs of water with them. And
Yes.
they have these nice Stanley cups with them, carrying
Yes.
their water around with them. You're saying it's not applicable for everyone.
No. So sometimes what happens is I have also seen some people who have been drinking a lot of water, but then they would say, I have, say, dry skin. Or they would say, I have cramps in my legs. You know why it happens? Because there is a lack of electrolytes. It is a depletion of electrolytes because in the process of having high level or like high amounts of water, when there is a profuse urination, they feel, oh, they are feeling, they are hydrating and they're urinating. But in this process, the healthy electrolytes also get depleted.
So we need to do everything in moderation, like
Yeah.
Ayurveda says.
Yeah.
It can't be this way or that way.
Yeah.
But how? So you were saying drink according to what your body needs, like what your
Yes.
body sends signal for.
Mhm.
That's important.
Yeah.
Other things that I should do at home for kidneys.
So in general, what happens is the exercise part is also very important. People certainly often overlook the importance of exercise.
For kidneys?
Yes, for kidneys.
Okay.
Because
That you have to explain.
Okay. So what happens is when the channels are blocked, for example, we need to open up the channels. We need to take out the ama from the physiology. So that ama, which is not an overnight accumulation of toxins, it is a long-standing process where the ama gets accumulated in the form of, say, it's kind of an adhesive, material, sticky material. It looks like kapha, or it is like I would say it's an unhealthy form of kapha.
Yeah.
Okay. So the difference between qualities of kapha and qualities of ama is like ama is sticky and smelly. It's a foul smelly product, which
Yeah.
is a byproduct of, or which is a toxin.
Yeah.
Okay. So then there are different kinds of amas also, like what is the level of adhesion and, what is the duration. And
Yeah.
then
And sometimes it gets fermented as
Yes.
well, where
Yes.
it starts, like smelling and becomes putrid.
yes. Yes.
And it sits in your intestines and for long.
Yeah.
So
In joints also.
in joints also, and then it leads to inflammation. So you'll see that. But how much of kidney is associated with ama filtration out of the body? Because I do know that intestines also play a certain role. Digestion also plays a certain role. Agni
Certainly,
also plays a
yes.
certain role. What percentage would you attribute to kidneys in terms of its detoxification power for the body?
So all the channels are very important. It's not only the Mutravaha Srotas. It is also starting from Rasavaha Srotas. Okay, Rasa, Rakta, Mamsa. And then, all the dhatus, the 7 dhatus, the bodily tissues, the Srotas are related to those 7 bodily tissues as well. But then there are also 3 different kind of excretory Srotas, which is one is Mutravaha and Purishvaha, which is excreta, and then Svedvaha, that is sweat.
Sweat.
Okay. And then we also have reproductive srotas as well. Shukravaha and Artavaha.
Yeah.
So this is kind of a, categorization of srotas. But in general, we have to be very aware of all the srotas detoxification starting from what we eat. Okay. Aharam hi paramam aushadam. Okay. So it is like whatever we are eating, we become that. Whatever we put in our body, not only in the form of food, also in the form of thoughts,
Yeah.
also in the form of lifestyle, also how we deal with people. So there are different scenarios that lead to that particular, essence of the body.
Okay.
So if there is an ama accumulation, we just have to figure out how we are detoxifying in the form of what is the level of ama first, and then for how long we have to detoxify.
Okay.
So we have to make sure that we are detoxifying in the form of panchakarma, or we are simply taking care of our body in terms of movement, exercise. That means our body gets opened up.
Yeah.
The channels get opened up, so that once the channels get opened up, it starts regulating its basic function.
Yeah.
So
I'll come back to Panchkarma later on, but we're, going on that list. You said hydration is important. Exercise is really important for kidney health. What are some other things at home? Are there any, kitchen box herbs that I can add to my diet every day, which can ensure that, to some level, my kidneys will be taken care of?
certainly. So depending on again doshas, but in general, what happens is we can certainly vouch for barley water.
Barley water?
Yes, barley
Jaw
water.
ka pani.
Jaw ka pani.
Okay.
So it is a very good detoxifier when there is a kapha involved,
Hmm.
right? And we can also focus on coriander seeds and coriander leaves water, or
Okay.
teas, infused teas based on that. Or we can also focus on, say, turmeric in diet. So a fresh grounded turmeric, which is, not very much available these days. It's mostly adulterated. We just have to look out for the original sources. And then we also have some kind of fruits like beets, fruits like apples and berries, strawberries and blueberries and cranberries are also a very good source of, detoxifying the kidneys.
Okay.
So they are generally, I give my patients cranberry, juice, or even cranberries to have that replenishment of magnesium, and also to replenish the, kidneys regular functionality.
Yeah. Any specific, I know you didn't mention that, but is there any specific exercise that you would recommend for kidneys?
In Ayurveda, from Ayurveda standpoint, I would say there are two beautiful yogasanas that we can focus on. One is Cobra pose, that is Bhujangasana. And it is also Ardh Matsyendrasana, that is seat twisted pose.
Okay.
So these are the two beautiful yogasanas that we should focus on.
If
because
you want to take care of your kidneys.
Yes.
Okay.
Yes.
Anything else that you would like to add to this list of, do's and don'ts, that this is how you should be? We didn't get into diet because, that's also very controversial. Some people are like, no, you need to add more protein, and Ayurveda says just eat everything in balance. What is your recommendation? One final recommendation. What is an ideal diet for a person to take care of their kidneys?
Sattvic diet. That is something which is not vitiating any doshas, and also in alignment with your prakriti, with your basic body constitution. So if a person is Pitaj prakriti, and if they are already eating high salt based diet, it would only lead to inflammation.
So understanding our prakriti, which is our body type.
Yes.
Understanding our vikriti, which is our current imbalance.
Yes.
And then eating according to that.
And eating in moderation, depending on the whole day, the day and night, that when to eat, what is the vata hours, or what are the pitta hours, or what are the kapha hours. And these are the hours where the dosha is highly predominant. And to balance one dosha, you just have to make sure that you're not aggravating the other dosha.
Yeah.
So this is the principle of Ayurveda treatments in general.
Do you think eating late at night can contribute to kidney problems?
Oh, yes, for sure.
Has it happened with your patients?
Yes. There are patients who have come to me, which, when they have mentioned that they have been having late night snacks, for example, midnight snacks. So what are in general midnight snacks? They would look out for chips. They would look out for, say, just pretzels, or they would look out for some snacks which are just handy, high, sugar, for example. So these all, when they are not digested properly, they would only lead to inflammation or accumulation of armor because they have not digested well. Because we get immobile or we get, just in a sleeping mode right after that.
Yeah.
So it takes a lot of toll on the kidneys because we are not filtering it properly. Yes. And then lack of water again. Overhydration and underhydration, these both are very, very important parts to take care of.
Okay. So these are the two things that you're saying are really important. One is not overhydrating, and the second is ensuring that your diet is sattvic in nature and suited according to your particular body type and your current imbalances.
The third important thing which I would like to highlight is to avoid smoking and alcohol consumption.
Yeah, that's a given. I think everybody by now knows that smoking and alcohol is contraindicative if you want to protect your kidney. So that is known. Now let's move on to the actual problems, because a lot of our viewers are coming here with probably who have kidney issues already. Creatinine is one.
Yes.
And somebody in my family that I know has been having a consistent increase in creatinine values for the past 6-7 years. They're put on some of the other drugs. So creatinine, at what stage are we at in terms of kidney disease progression?
So creatinine is a byproduct. It's a waste product which is released from the kidneys, and it is also assessing the kidney health. Okay. And that is a byproduct of the protein assimilation. And if there is a high level of creatinine in blood, that means the kidneys are overburdened again, right? There is a general, range of creatinine like 0.74 to 1.35 mg per dl. So when the creatinine is more than 1 or it is consistently 1, that means we really have to look out for our kidney health.
But how does Ayurveda treat it? Like, what is the big thing that Ayurveda can do? Is it too late for us to come when our creatinine levels have gone up? Like, because I know that in kidney, it just keeps progressing. There is no stop. There is no way unless you have a transplant, which has its own challenges. Where can Ayurveda intervention be done?
So again, as we were talking about the pathogenesis of a disease. So there are 6 stages of a disease, right? So the first 3 stages are when the doshas are in its own place, in their own place. And that is called dosha kriya kal. And this is where the diet and lifestyle and all the measures which can be taken care of to protect the kidneys, in this case, to manage the doshas before they have localized into the different organ systems.
Yeah.
Okay. And then the third and the fourth, fifth, and sixth stage are the stages where the disease has manifested. It has started to show symptoms, tangible symptoms, or it has started to create complications if it has not been treated on time. Right? So in general, what happens is the dosha kriya kal, or the first 3 stages, are overlooked by people. They do
That is
get
where the urine is becoming frothy and, it
Yes.
is turning out. So you're
Sometimes.
feeling fatigue and
Yes.
dry skin suddenly.
And vertigo also. There is also one symptom as vertigo if the kidneys are overburdened.
Okay. So these are the symptoms one should look out when the doshas are not where they're just, aggravated at their own places.
Yes. But
Okay.
then there are different other symptoms in terms of, say, neuropathy, for example, or blurry vision, or, sweet taste in mouth, or something which is also hypertension as well, or, which is, and these symptoms are also multifolded, or we can say the prevalence or the intensity or the frequency of these symptoms have gone much more and higher.
Okay.
Yes.
So if somebody comes to you with a high creatinine, what kind of treatments are available to them and what kind of hope do you give them?
It depends again on prakriti first, right? So if the prakriti of a person is aligned or in tandem with the vikriti, then we just have to figure out whether this disease is progressed to a place where it is not reversible, or this disease becomes reversible, or it is, it can be taken care of. So for example, if the person is vata prakriti and the symptoms are also vata, that means that particular part is like there is a high chance of visheshan of vata to a level that it takes a little bit more difficult to get treated. So starting from kapha to pitta to vata, depending on what particular dosha is involved, is the also ascertainment of the prognosis of a disease. And if the person comes with high creatinine, for example, what happens is they would come when they have um also have been facing different kind of symptoms. Then only they'll get their blood work done.
Yes.
Right?
Yeah.
They would just simply not get a preventative blood work done.
Not at all. I
Not
don't
at
think
all.
anybody really thinks about kidneys.
No.
Like I am in my 30s and I have never really looked at my KFT profile or anything like that. And we mostly focus on LFT and, all other functioning, but nobody really focuses on kidney as much as we should.
So this is where I mentioned about the prodromal symptoms, or the symptoms where somebody has sharp shooting pain in the flanks or in the back region, or somebody would say, I'm feeling a little bit weak, or I'm feeling dehydrated, or
Yeah.
I'm feeling some kind of, slight swelling when I sit for long or walk, or stand for longer period.
Yeah.
So this is where the kidneys are getting under pressure
Yeah.
and they are getting worked up or burnt out, I would say, right?
Down.
So that's when we just have to be very careful. And when they are, I would say they are aware that yes, they are getting these things. Again, I would certainly relate it to Prakriti. If there is a Kapha Prakriti person, they would say, oh, it's fine, let it be. They'll procrastinate. If there is a Pitta person, they would certainly be highly calculative and they would be very analytical, and they'll probably go to the doctor right on time and they'll say, no, I think I have to get rid of it. And they'll get their blood work done and everything. And the Vata person, they would be like very jittery about it. But
Worrisome.
yes, they'll be worrisome. They'll be like a bubble at one point and they'll just forget about it again. And they'll be very erratic to rationalize the importance of what has happened to them. So then that's how it depends on what blood work has been done on them. And in Ayurveda, we do not have that, leverage of blood work, but we certainly have to have this help, I would say, or support of medical system, that this can be a tangible result to show that whether the kidneys are functioning properly or not.
So coming back to my question, if somebody comes to you with high creatinine, what kind of treatment options do they have? Do you put them on panchkarma? Do you give them herbal medications? What is their prognosis like?
So depending on, again, when we are talking about Prakriti, right? We start with Nadi Pariksha. We start with Darshanam, Sparshanam and Prashanam, right? So we have a look and feel of the person, that what Prakriti they are. And then we also take the pulse diagnosis. And with deep pulse diagnosis, we can figure out what is the level of dosha vitiation in that physiology.
Okay.
And then on that basis, we'll ask questions related to that. The questions are basically reflective of the symptoms which the person is experiencing.
Yeah.
The signs are seen by the doctor or the Vaidya or the physician when they are having the physical appearance or physical testing. But the symptoms, the person would speak out of them.
Yeah.
And that is when we can tally that, okay, do you have any kind of challenges like this or not? So then we make a clear diagnosis whether this particular dosha is involved or that is involved, or whether there are any associated symptoms like burning in the joints, or is there any kind of blood pressure issue or any blood sugar issue like high blood sugar or glycemia or something like that.
That's okay. But do they get panchkarma? Do you recommend panchkarma for people with kidney issues?
Yes, they do.
Does panchkarma have the power to change creatinine values?
So again, it comes to the detoxification level of the kidneys. And when there is a panchkarma which is done with proper, classical way, it certainly has a certain way of helping the kidneys, not only kidneys, but the overall functionality of the genitourinary system. So we generally give snehana, oleation, and we also give svedana, depending on what is the level of ama in the physiology. And then we start with panchkarma procedures. So in this case, we give bastis, or we also give virechana, the purgation therapy. So bastis can also be done like anal bastis or uttar bastis, which are from the reproductive organs.
Yeah.
So depending on that, we just decide on the parts of the panchkarma, what has to be given to them.
Just one, question. You mentioned protein and excessive protein use can also lead to kidney damage.
Okay.
Does protein shake cause kidney disease?
It can. Too much of protein shakes like whey proteins, for example, or anything which is having a breakdown of not protein, I would say it is purine. So purine is a byproduct where it leads to the accumulation of toxins in the joints or accumulation of toxins in other parts of the body. And that is where we have to be very careful of what food items we are picking, or including whey proteins or including different kind of protein shakes. These days, people would be, especially the youngsters, they are hitting the gyms and they are just, having those shakes around them. And then I would not suggest them to rely on those protein shakes. Instead, look out for your Prakriti first and then see whether this protein shake is really working well on you or not, rather than just, bottling them down or, gulping them down just for the sake of having that
muscle.
energy or that. Yes. And in Ayurveda, we certainly have some kind of herbs which are very, very beneficial for musculoskeletal system and which develop the muscles and which help in maintenance of those muscles and helping the kidneys as well.
Can you recommend protein shake replacements in Ayurveda?
Yes. Gokshur,
Okay.
Gokshur powder, amlaki, bhumi amlaki, barley water. So these are few things which are really very helpful. And I
Okay.
have seen in my patients also, I've been giving those to my patients, and they are actually having very good results, equivalent results when somebody is having regular Gokshur powder with warm water before having their, gym routine and everything. So
And it works for them?
yes, athletes have been using Gokshur powder now in the West.
Oh, wow.
So I think we Indians have to be very, very, we should be proud of it. But at the same time, we have to be aware at at that level that yes, if somebody else is accepting and adopting our pathy, why can't we?
Yeah. So Gokshur water is suitable for all body types?
So Gokshura is basically cooling in nature
Okay.
and it is nourishing. It also works as an aphrodisiac.
Okay.
And it works beautifully on the genitourinary system because it works as a nourishing detoxifier. It's a Brahmana Chikitsa. It's a nourishing agent. Then there are other herbs like Punarnava. So Punarnava is anti-inflammatory. It's one of my favorite herbs. I have been giving Punarnava for many, many years to my patients. And then we also have Guduchi. We have Varuna. So Varuna is also a natural detoxifier. So there are certain kind of classical formulations which have most of these herbs which are inclined towards genitourinary health or kidney diseases. We have been giving them because they work as natural detoxifiers. They work as diuretics. They also work as nourishing agents. So depending on what Prakriti we have, we can certainly, pick and choose and
Okay.
give those to the
So
patient.
in totality, if I were to ask you Vata, Pitta and Kapha, if you were to give protein shake replacement to these three Prakritis, what would be your top choices?
So Punarnava for Vata and Gokshura for Pitta and barley for Kapha.
Okay, great. Moving on to our next section, which is kidney stones.
Okay.
Now, kidney stones is it's not so complicated, and some people are able to naturally detoxify themselves with kidney stones. But what is Ayurveda's take on it? Why do they happen, and what can one do about it?
So again, it comes from the dosha perspective. Because kidney stones are nothing but a condensation or an accumulation of those toxins which have not been able to get evacuated. So they are mostly generated out of kapha. But if there is a vata involved, there would be a drying up of that toxin. And if there is pitta involved, there would also be again drying up, but at the same time, there would be inflammation along with it.
Yeah.
So depending on that, if the kapha is involved with vata, there would be different symptom. If the kapha is involved with pitta, there would be different symptom. If it is just alone kapha, then it would be different symptom. But it's mostly about the accumulation of toxins in a condensed form in the urinary bladder or even in the kidneys itself, which take time. And sometimes they are there for ages, for years, right? And then they get in dormant stage. But when they are wanting to pass down, sometimes they get stuck in the ureter.
Yeah.
Right? And there is a very interesting difference between men and women. In women, the kidney stones prevalence is there, but it is not as strong or higher as in men.
And why is that?
Because even if it is accumulated, it gets evacuated or eliminated from urethra, from female, organs very easily. But the aperture or the urethra of the male is like 7 mm. So if it is beyond that, there is high possibility of getting them accumulated and getting, stuck
This
in
is
the
for the
urethra.
ladies, one
Yes.
benefit of having a female physiology is you're able to flush out your kidney stones much easier
Yes.
as compared to males. Okay.
Yes.
So that's point number one for women who constantly struggling with menstruation issues.
Yes. So we
Anything-
are blessed with many things
Yes.
otherwise.
We are, but we do see a lot of women, struggling in general with other issues that adding kidney problems to it might be a lot more problematic. And I know that men also are more likely to suffer from kidney disease in general.
Yes.
And is that the reason that they're not able to flush out the toxins very easily?
Yes, because then there is a back pressure which leads to hydronephrosis, which leads to inflammation of the kidneys. And this is where there would be more possibility of having the pain in the flanks and also severe renal colics. I have seen a lot of men who have been struggling with it, and I've seen people who have been undergoing the lithotripsy and different kind of procedures because it is
break
very
the stones.
painful to break the stones.
Yes.
So this is where we just have to be also understanding that whey protein or protein shakes are not the only choice. So if you are adopting healthier lifestyle, if you are avoiding smoking and alcohol consumption, if you're also making sure that you're hydrating well with different kind of herbs, turmeric, coriander, or say barley water, as I said, or even this gentle herbs like amlaki or gokshira or guruchi, that would certainly keep your diseases at bay. And that would make sure that you are having a healthier kidney for years and years to come.
So if somebody comes to you with kidney stones, does Panchkarma have the capacity to dissolve kidney stones?
We have to figure out at what level the kidney stones are. Because if the kidney stones, certainly we have to find out a way to locate the kidney stones first. We cannot just blindly say that you need Panchkarma. Sometimes the kidney stones are there, but they are stuck in a part where it can actually aggravate the issue. If we are, for example, if we are giving, say, a highly diuretic herb, okay, or if we are saying drink a lot of water, but the kidney stone is at a point where the kidneys are now generating a lot of urine, but then there is no way to pass it down. And it is getting stuck. And then there is a back pressure of urine.
Yes.
Right? And that would lead to hydronephrosis. That would also lead to high blood pressure. So this is very important to understand that where is the kidney stone, what is the prevalence, how often it is occurring, what is the size of it. And based on that, we have to judiciously pick the drug of choice or the herb of choice, whether it can be broken down. There are very beautiful herbs like Pashan Bhed. So Pashan Bhed is one herb which actually breaks down the kidney stones. Even Trifla is also something which dissolves or, reduces the, size of kidney stones. So other than Gokshara and Punanava and Varuna, these are few herbs, and even Shilajit also, right? So these are the herbs, how we are picking them according to body type again.
Yeah.
So that's where we have to probably look out for the kidney urinary bladder X-ray, or we can look out for an ultrasound. And that's when we need to decide whether what stage of that kidney stone the person is. And according to that, we can see alongside the level of Ama, alongside the Bala, the Vyadikshmatva, or we can say alongside the immunity, eligibility of a person for Panchkarma. So all these things have to be taken very judiciously into consideration. And that's when we decide. We should not blindly follow that, okay, we can do Panchkarma for whoever comes to us.
Okay. So you do have a treatment regimen available for those who have kidney stones as well.
Yes.
And it is reversible, or sort of it is solvable through Ayurveda alone, or does it also need modern medicine intervention?
It depends again upon the prognosis of the disease. If it is required to have medical intervention, we should certainly look out for that. If there is a requirement of, for example, surgery or a dialysis, we should not hesitate and should not claim that we can do it.
Yeah.
Yeah.
So tell me this, out of all of these herbs that you mentioned, I'm sure that, for our viewers, they should not be taking those herbs at home, except probably Trifla, which is still relatively safe. What do you recommend to take at home in case, somebody has a small kidney stone being developed and they want to do something at home just as an addition to their treatment regimen?
So, depending on their alkalinity of the urine as well, they should just focus on kshara or alkaline stuff like radish, for example, or some other, beetroot. And, just regularly have some other, basic herbs like coriander and turmeric and cumin. So, depending on, again, what is the requirement of the body.
Okay.
I have seen people who are eating a lot of spinach. That also leads to kidney stones. Kale is also one of the green vegetable which has high level of oxalates. So these are, when they are taken raw, people are very fond of lettuce and kale and spinach as salads. I would highly recommend to at least blanch them, if not in a cooked form, so that the oxalates get, broken down, and that's when you can be safely eating those green leafy vegetables. So this is very important. Raw leafy vegetables can lead to kidney stones. Even paneer. People are very fond of paneer, but then, that also may lead to, because it also leads to accumulation of kapha eventually, right? So we just have to figure out what dosha is mostly involved, and according to that, we just take care of those things.
So for vegetarians, what would be a good protein source? Because you've taken out paneer, you've taken out the salads. What would you recommend to them as a protein source?
I am not taking out them. I'm just trying to twist them or recreate them in a way that they are easily digested by the body.
So how can we convert paneer into a better digestible form?
Better to eat paneer in lunchtime rather than at dinner time.
Okay.
And make sure that you're not eating too much of it again. Moderation is the key.
Okay.
So,
one meal a day is okay?
I would say 2 to 3 times a week is fine.
Okay, not more than that.
That's fine. Okay. And then also dal, moong dal is also one good source.
Okay.
So there are also various doctors would also say that, chilke wali dal nahi khana hai types, because it also takes, sometimes they would say they're high in protein. It's not about protein. We just have to emphasize on the level of purine in a particular diet.
So what is purine?
Purine is also a byproduct of proteins. And this is where it gets accumulated in the joints and other body parts as, crystals. It creates crystals and also leads to gout and gouty arthritis and other diseases like that.
So you're saying that dals have purines in them already?
Not all of them, but then there are certain dals which have high level of purine in them. So we just have to be very careful of that. Kulat is one dal which is not having, a lot of purine, but it is also a stone breaker.
Oh, really?
Yes. So kulat dal or horse gram, we call it. So that kulat dal is wonderful. I have been giving my patients the kulat dal soup or a horse gram soup, and it has worked wonderfully because it also ignites the dhatwagnis, like digestive fire, and also makes sure that it dissolutes the ama in the physiology. And it really helps for people who have kidney stones and even obesity also.
So kulat dal. Any other herb that you specifically can recommend only for kidney stones, which already resides in our spice box?
Again, I would say barley.
Barley.
Barley water or barley tea is something that we should focus on.
Is barley water heating in nature, or is it okay?
It's drying in nature.
It's drying.
So for Vata people, it is not recognized or recommended.
Okay. But Pitta and Kapha can have it safely.
Pitta and Kapha can have it, mostly Kapha.
Mostly Kapha. Okay. Moving on to the other big problem that this next decade or two, that most of the health agencies are pointing out, that kidney transplants are on a rise, and chronic kidney disease is going to be the next big health challenge. And they're also looking into pig transplants and, transplants from other species, which is altogether a different issue. But in your perspective, when somebody reaches that stage of chronic kidney disease or kidney failure, where they are in line for a transplant, Is it too late to come to Ayurveda?
Yes, because again, I say we should not claim what we do not know whether we can treat or not. So, if there are herbs which are really supportive, we can handle them. We can take care of that physiology with the perspective of a palliative care or a supportive care, so that it does not give any more damage or does not make the kidneys damaged any further. So, if there is a requirement of dialysis, we should not hesitate to look out for a doctor who can do that. And because there is already, I would give an analogy to this. It's like a strainer which has blocked. It has to be cleaned first, and then only the rest of the straining would be done, right?
Yeah.
So that strainer needs to be cleaned. And if it is required, if there is a requirement of dialysis, I think we should go for it. But if there is any possibility that we can avoid it, rather than delaying it or rather than coming to a point when it is irreversible, it's always good to have a support of a medical doctor alongside.
One final takeaway. Vata, Pitta, and Kapha people, both three different types of bodies. What would you recommend if they were to take care of their kidneys at home?
So for Vata people, we need to understand that yes, there is some, a particular area where they are basically avoiding. It's like they do not rest. They are like always on the go, right? And they have lot on their plate. So rest and hydration, these are two important things that they have to take care of.
Okay.
Pitta people, again, cooling foods and something which is cooling down and avoiding salt intake because it leads to inflammation.
Okay. And Kapha?
Avoiding sedentary lifestyle. If it is sedentary, make sure that you move, make sure that you do exercise, incorporate yogasanas in your physiology, in your daily routine, and also incorporate some specific herbs like barley. And also make sure that even triphala is also something which is wonderful.
I think this was a very interesting conversation. Thank you so much, Dr. Amandeep. Not a lot of people talk about kidneys, and today the way that we have opened up this conversation around kidneys in general, I think it's very interesting. Most of you think that kidney health or kidney disease is sort of not solvable, or it's not reversible, but it depends on what stage of kidney disease progression you're at. If you're somebody who feels they are at risk of kidney disease because somebody in their family already is suffering with hypertension, diabetes, or kidney disease, then make sure that you get yourself tested every now and then. A Vaidya can really help guide your journey with proper pulse diagnosis. They can even tell you at what stage of disease you're at. So if you're somebody who is on the way to kidney disease, Vaidyas can really capture that through pulse diagnosis. So make sure that you understand that kidney disease is not something that you have to live with or develop over a period of time. Because most of the people are having sedentary lifestyle these days, and some people are actually having an overexerting lifestyle. Both is not okay, right? We need to have a proper moderate amount of hydration. Excessive salt or excessive hydration both is a problem for kidney disease. Like Dr. Amandeep said, spinach is not at all a good thing if you are somebody who is suffering from kidney disease. Make sure your dals are also limited to the ones which have less amount of purines. Something like Kulat's dal is what Dr. Amandeep recommended. And there are a lot more suggestions in this entire video. So if you've missed something, scroll back and see what are the good recommendations for your particular body type. Thank you so much for joining us. Make sure you subscribe to our channel for these amazing Ayurveda tips. And if you would like to connect with us and get a proper Vaidya consultation, call the number below. Like, share, and comment on this video if you think this helped you today. Thank you so much. Jai Gurudev.
Jai Gurudev.